Welcome to our last learning unit, and that's learning unit number 7, where we're speaking about advocacy for the vulnerable. And please note right off the bat that this learning unit is shortened due to time for the final course reflection, which is during finals week next week. So you're going to see that right after this learning unit. You're going to see the final course reflection that will be due. So double check the dates and know that we're nearing the end of this course. And in this shortened unit, we're looking at the concept of advocacy. Advocacy for ourselves, for the nurses that we lead, as well as individual patients, groups, and populations at all levels. Advocacy can be defined as an activity on someone else's behalf directed toward a specific goal. For the nurse leader, the goal is a better state of health. So during this course, we focused on a better state of health for those who are most vulnerable. In doing so, we identified that human connection and compassion truly forms the foundation for advocacy. According to the authors of Compassionomics, compassion protects the vulnerable. It's about treating others the way they ought to be treated, the way they want to be treated, and the way we would want to be treated ourselves. And so we're going to finish this unit with reflection on Provision 8 of the ANA, American Nursing Association Code of Ethics. Provision 8 states that the nurse collaborates with other health professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. So at the end of this learning unit, you're going to have reflected on Provision 8. You're going to have to be able to articulate the evidence that making human connections, serving and caring for others, has proven stress-relieving benefits. So you're going to do this in a couple of ways. And of course, I have modified the amount of work so that you can complete in a shorter period of time. So the last thing that you're going to do is discussion board 7. Post only, no replies required. If you want to reply to one of your colleagues, of course, please do. So you're going to start by listening to an interview of Dr. Treziek on the more recent book. I'm trying to think, is it 21 or 22, that Treziek and Mazzarelli published. And that book is entitled The Wonder Drug. Now, I've read that. I knew that this book was out, and it was a newer book than Compassionomics. But Compassionomics really, truly was written for the healthcare professional, whereas the Wonder Drug is written for all, for the lay population, I guess you would say. So, and very similar content, just kind of put out there to a different population. So I recommend that you get the Wonder Drug. It's a good read. I got it from the library. But this is an audio interview of just Dr. Treziek. He does most of the interviews from what I have found. And it will take just a few minutes to download, and you have to download. It's free. There's nothing that it asks for. And the actual interview starts at the 6:15 minute marker. So if you want to skip some of the brief stuff in the beginning. So this will take you about 40 minutes to listen to. And here's a 2-page document, again, written by Treziek and Mazzarelli in 2022, I do believe, and about serving others is the best medicine. So this goes along with the interview, but actually I heard and read slightly different things. So it's not just a repetition. Very nice short article. And the last thing you're going to read is a 1.5 pager of ethics and social justice. And this is where we're probably reintroduced to Provision 8 of the American Nursing Association, the American Nursing Association's Code of Ethics, excuse me. So these all tie in together for the discussion board. And for the discussion board, you have read Compassionomics, you have listened to Dr. Treziak in an audio interview, you have read an article by Treziak and Mazzarelli, and I just pulled 3 different statements, 3 different quotes from these sources. And please add more in your discussion board, but I'm asking you to reflect on at least, or at least these 3 statements, that serving others is the best medicine for yourself, looking outward, making human connections, serving and caring for others has proven stress-relieving benefits, and burnout isn't just about being overworked, it's also about the absence of meaningful human connection in one's work. So after you have looked at and read and listened to this information, and we know that Treziak and Mazzarelli are physician scientists, and they do base what they say on the evidence. So how can the evidence that our authors have shared guide us in advocating, number 1, for ourselves as a nurse and the nurses that we lead? So there is no reply that is required. The next article that you might have just seen a peek of, that is not, we're not doing it. This is where we're ending. So that is completing of learning unit number 7. And then you do have your final course reflection that will open the same time that learning unit 7 opens for you. Your final course reflection will open, and that will be due on the last day of finals. So please make sure you're looking at the dates things are due, because I cannot accept anything, any work after the last day of finals, which is December 14th. So please make sure you hand in anything that you've been missing or by those dates, because I need to get your grades completed and submitted. So thank you for all of your hard work and for all that you've done and your willingness to stretch and to look at things from a different lens, perhaps. And I appreciate it. So looking forward to having some of you, I'm not sure if it's going to be all of you as far as where you are in the program, but in resiliency in the spring especially. So this course really starts to add a lot of information that we'll need for spring. So I hope you've enjoyed the Compassionomics and the different learning assignments. And again, thank you and have a wonderful holiday.